In the healthcare system in eastern part of India has taken a long stride in last 20 years. So there have been more private hospitals in this part of the country. The government hospital, the standard has definitely improved, especially I can tell of West Bengal. In Orissa also, the medical colleges and the standard has gone up. So as a healthcare system in the last 2 decades or last 1 decade has improved, but still there are a lot of things to be done in the healthcare system. The infrastructure has improved, the quality of doctors has improved a lot. There are many more young doctors coming into the practice and joining healthcare system in private, both private and government sectors. So I'll say this has improved, but still it has a lot of space to improve in compared to other states of India. I joined Calcutta 30 years back in a place called Kothai Center, and my boss, Dr. Jalan, he was the first GI in that part of the country. So he had sent me to Hong Kong for training. I had training in endoscopy. I started endoscopy, therapeutic endoscopy like ERCP and other techniques in Eastern India. We initiated the procedure. So we're doing lots of cases like ERCP and all sorts of therapeutic procedures. I have shifted to CMI just 5 years back. We do quite number of cases, lots of cases. And therapeutic endoscopy has come at par to different parts of India, excepting few like endo-ultrasound and some of the advanced third space endoscopy. Otherwise, we do most of the therapeutic cases in our hospital at the present moment. And the journey so far has been quite good, and there are many doctors doing therapeutic endoscopy. I am very glad to say that initially there are only few in Calcutta. Now in almost all the states in Eastern India, we have got good number of therapeutic endoscopists who are doing good work in different states of Eastern India. We lack in one thing is endo-ultrasound. We know endo-ultrasound has a lot of impact in the treatment of various GI disorders. I am little sorry to say that the endo-ultrasound hasn't taken a long stride or a big in our part of the country. I don't know the exact reason. There are some good talents, but US still has to lot of things to be done on endo-ultrasound and liver transplant. The other thing is liver transplant. These 2 things, I still think this part is lagging behind as compared to the other parts of India. So we have to think seriously what is to be done in these 2 fields, especially endo-ultrasound and liver transplant. Why we don't have a good unit of liver transplant? Why we don't do a lot of US work in this part of the country? These 2 things, besides these 2 things, I don't think that we lag behind in the other counterparts of other parts of the country. I think there are very good young talents coming from UK and mostly from UK. They are doing very good job in different private or corporate hospitals in Calcutta or in Odisha also, in other parts of Eastern states. I worked in CMRA for last 5 years. This is the first private hospital built by Birla Group, and this still stands one of the icon hospitals of eastern part of India. We have got it's a multi-specialty hospital, and we cater to different groups of patients. And still the footfall is very high, and we have a big name in Calcutta also. And the GI department in CMRI, I think, was adjudged last year the best GI department in the Eastern Zone by the Times of India group, that we were the number 1 in the GI care in eastern part of India last year. There are a lot of things to be done, as I said, on endo-ultrasound and liver transplant. I've been trying to impress my seniors, management people, to start the clinic, because I have come to attend the conference by this global group. It's been a wonderful experience. I met a lot of people, and this has given me an impetus to start something when I go back to my hospital. Why do we lack and what is the reason? We have to dissect that and do something that we can be at par in liver transplant and endo-ultrasound in our center.